Hey, well, good afternoon, everyone. And I think all of us here are in DC, but we're glad to speak to you wherever you are. I'm just excited because you know what? We have the Brandons back. So in 2014, I think we started this group, well, 13, we started this group called the Brandons. And it's been alive ever since. We had a few breaks, but we're back together. Brandon Webb of Amazon, formerly as Chief of Staff for Congresswoman Kelly and head of the Health Brain Trust, is serving as today's moderator. I don't know if you've done anything with NMQF, you've probably worked with Brandon over the last 6 or 7 years. But he recently, well, a year ago, a little more than a year ago, left Congressman Kelly's office and he went to go work on policy issues at Amazon. And we're glad to have him today. He's going to be moderating this panel on COVID outreach and community. So without further ado, to Brandon Webb.
Thank you, Brandon, number one. And I want to extend a big thanks from Amazon to the National Minority Quality Forum, my hero, Dr. Puckrin, and our virtual attendees here today. I have the honor of not only rejoining the NMQF family, but introducing two amazing leaders in the public health arena. And these two individuals are Dr. Rodney Taylor of Gilead Life Sciences and Marvin Figueroa, Director of Intergovernmental and External Affairs at the U.S. Department of Health and Human Services. We'll hear from both of these gentlemen in just a bit, but I wanted to go ahead first and brag on them before we get started. And I will start with Dr. Rodney Taylor. He is a successful medical science liaison and pharmacist with 20 plus years experience in multiple therapeutic areas. He's been with Gilead Sciences for 7 years, working on respiratory cardiology, inflammation, and virology. Dr. Taylor currently supports Veklury from treatment of hospitalized patients with COVID-19. Outside of Gilead, you can sometimes find him reviewing and reconciling residents' medications in assisted living homes. So truly a servant leader in that space. Next, we have another servant leader and one of my favorite Virginians by way of Honduras, and that is Marvin B. Figueroa, who serves as the Director of the Office of Intergovernmental and External Affairs, IEA, at the U.S. Department of Health and Human Services. In this capacity, he is the Secretary of Health and Human Services Principal Advisor on strengthening intergovernmental relationships with state, local, territorial, and tribal governments, as well as private sector, nonprofit, faith-based, and other external partners to advance the administration's health and human service priorities. In addition to leading the IEA staff in Washington, D.C., Director Figueroa oversees 10 regional offices representing the Secretary and the administration at both the state and local levels. So that brings us to why we are here. This month, the first case of the Omicron variant was identified in the US, and we're here today to discuss the continuing spread of COVID. So I will start with Dr. Taylor for his presentation. So please, Dr. Taylor, enlighten us.
Good afternoon, everyone. Rodney here. I'm adding my slides up. We're going to give you an abbreviated version of what we've been doing at Gilead on the medical affairs team, probably now for the last 9 months. I've been working in the space of COVID-19 for the last 18 months, and I long thought this would be over by now, and unfortunately, it is not. Many of us on this health professional side, we were all doing some other job prior to COVID-19. I'm pretty sure everybody on this call was doing maybe HIV or oncology or something else, and now we find ourselves, completely dedicated to this COVID-19 space. And as part of that, we set out to reach the community and really try to get, I guess you would say, concise, trusted information to as many people as possible when there was a lot of things going on online and in the internet and word of mouth about COVID-19 and its impact on the U.S. We wanted to try to clear as much of that up as possible, so we set out with this, what we call a community outreach webinar series. Some of you may have seen this before, so this will be an abbreviated version of it. What you see here, we put this together to provide scientific information in a relatively simple format to assist you in educating members of the community. So family members, friends, people who trust you with this type of information, you could actually use this slide deck to give them valuable information around COVID-19 and from a trusted individual, someone that they know. If you guys, everyone that's on the phone, if you do have a chance, there's a survey that is a part of this slide deck. It's a pre-survey and a post-survey. It's around 7 questions each, 7, maybe 8 questions each, pre and post. If you have your cameras or your phones or camera phones with you, you can take a quick snapshot of that QR code and we'll lead you to a survey. If you have a chance, I really would appreciate you answering the questions around the survey. What it does is simply helps us gauge what we're doing, how we're doing it, and if the message is resonating, and we will make changes to ensure that the message is coming across clear to all individuals. So this is why we ask for the survey. We collect a little information, and secondly, we use it for improvement of the materials that we use to reach the community. So if you get a chance, just scan the QR code and click those boxes to answer those survey questions. And then we'll do the post-survey at the end. The original presentation, and we won't go through all of these, this is exactly what we wanted to describe, the COVID impact, how to slow the spread, what the FDA is doing, the approval process, vaccinations, testing, etc. Here, I want to spend a little bit of time on this particular slide. I think this is an important slide for everyone to have at least a baseline understanding. This is what we know now about COVID-19 and the course of the disease. At the top of this particular slide, you see the infection phase. You have the early infection phase, and what happens in this phase is this is when the virus, which is SARS-CoV-2, is really replicating. So you see that blue triangle there is pretty high. This is where the viral load is at its highest. So the initial part of the infection, you're replicating virus rapidly, and this is the most infectious part of the process. This is where you can infect others, and this is right around from day 0 to day 7 of the disease course is considered early infection, and when people are most infectious and when the virus is replicating rapidly. You will reach this pulmonary phase where we'll bring in a cough, difficulty breathing. Although the virus itself may be slowing from a replication standpoint, the impact has been felt by the patient. They're starting to see more and more symptoms. In that early infection, you're probably only going to see maybe a fever in that early infection. And then finally, we talk about this hyperinflammatory phase. This is a phase that we want to avoid at all costs. This is your body responding to the impact of the virus, but it is responding in a very negative way. It is over-responding to the virus. It is producing what we call cytokines that can go and actually destroy even healthy tissue. So it's a hyperinflammation phase. Inflammation is important when you're trying to remove or clear the virus, but when you go into an overdrive, it actually can be detrimental. And as you can see at the bottom, and the reasons why it is important for patients to understand or anyone to understand, as soon as you're diagnosed with COVID-19, it's important to act fast, because if you catch the virus in that early infection phase with mild symptoms, there are things that can be done. There are therapies that are available. There are antivirals. There's monoclonal antibody therapies, and they all have a time dependency to them, right? To qualify to take these drugs in certain instances, there's a certain period of time. A lot of times it's within 3 days, 4 days, 7 days, maybe even 10 days of symptoms. You may want to have either an antiviral or some type of antibody therapy on board. If you fail to meet those time frames, and you progress to this, what we call hyperinflammatory phase, you will need something, what we call immunomodulators. These are things like steroids, and for the most part, dexamethasone is the primary steroid that's used for COVID-19 in these critical or very severe patients, and it helps dampen that immune system response. But to avoid all of this, this is only if you actually get COVID-19. We know there are important ways that you can avoid all of these. I'll mention some of those very quickly, but I wanted people to understand the disease course, take action early in the infection phase where you have more options available to you and it's less severe, versus in the lower, the phase here in the hyperinflammatory phase or the pulmonary phase is where you end up going to the hospital, in the hospital, intubated, and a lot of negative consequences could happen. So I want you to have that understanding going forward. But the key is to avoid all of this altogether. Here's a look at where we are now, and this data, as you know, changes every day. When we put this deck together back on September the 30th, we were at 695,000 deaths in the United States. I just pulled the information from cdc.gov. We're currently at 790,000 plus deaths in the United States. Put this together September 30th, we went from 43 million cases to now 49 million cases. So the impact of COVID is still here. You can see it in the numbers, and the numbers are what they are. They're really undeniable. When you look at the minority populations, some of the populations, Hispanic, Black, African Americans, these populations have inherent biases as far as they're not given or access to certain care, and this can lead to disproportionate impact for all diseases. But you see the same thing has came across with COVID-19. If you look at the Hispanic or Latinx population, they are 2 times or 3 times more likely to be hospitalized than when compared to the white population. Same with Black African Americans, 2.8 times more likely to be hospitalized for COVID-19. If you look at death, 2 times more likely for Black or African Americans and 2.3 times more likely for the Hispanic or Latinx populations to die from COVID-19. So this is an example of ongoing issues with delivery of health care, availability of health care in the United States that we would love to continue to address. COVID-19 just really highlighted this impact that we've dealt with for years, and it's something that we are working on every day. One way of doing that is education, giving people the information so they can act sooner on their own behalf to avoid COVID-19 if they can, and seek treatment immediately if they cannot. A little bit about the vaccines. We know how they work. They help protect against COVID-19, and they certainly help protect you from a severe case of COVID-19, right? Preventing hospitalizations or death. So that's the value of vaccines. They're not 100%. I haven't known much to be 100%. So there's patients who will have COVID after they're vaccinated, these so-called breakthrough cases. But what they do is prevent you from severe, complicated, critical COVID-19 diseases, and the data has been consistent since the very beginning. They help you recognize, they help the body recognize the COVID-19 or SARS-CoV-2 virus. To be fully vaccinated, there's a couple 2-dose series out there by Pfizer and Moderna. There's a single dose vaccine by J&J. So all of these are important. Here, when we put this deck together, we were talking about the Delta variant. The Delta variant swept through, pushed out all of the other Alpha, Beta variants really quickly because it was highly transmissible. We know that the vaccines are still effective and protect even against the Delta variant. Now we're talking Omicron. They are doing testing as we speak as far as the efficacy of the vaccines to help protect you from severe cases of COVID-19 based on the Omicron variant. So we are working and looking at that data every day, and it looks to still be some protection there as well. Now, the FDA, there are several ways in which the FDA can get medicines out in an emergency situation. So there's a full approval process, the standard way that all drugs are approved. You have to provide safety, effectiveness, and then you got to produce quality medications. For all of the vaccines that are currently available here in the United States, they are either fully FDA approved or they have an emergency use authorization. So the FDA will use an EUA in certain situations, and where the benefits of whatever it may be, the vaccine or the medicine, outweighs the risk. Certainly, this is an emergency situation with COVID-19. As of today, the Pfizer-BioNTech vaccine is fully approved, and that was on August 23rd, 2021, for individuals equal to or greater than 16 years of age. The Pfizer-BioNTech vaccine has an EUA, so it has an emergency use authorization for a younger population, so the ages 5 to 15 years old. And as all of you may know, now boosters are available from Moderna, from Pfizer, and J&J for all patients 18 years and older, and then for Pfizer now, I think they added 15, 16, and 17 to that group just yesterday. So the data changes often, but the virus changes just as often, and that's why the data change. So as the viruses change and mutate, the data requires you to look at the data and make decisions based on what the viruses are doing. And viruses change all the time, as you know. Here's early data around some of the vaccines, and what I want you to look at here is they were required to have roughly 30,000 patients in the initial trials. These are just the initial trials of the three vaccines, Pfizer, Moderna, and J&J. If you take the total U.S. population of 258 million who were eligible to take the vaccine, what percentage of patients in those trials for Pfizer, Moderna, and J&J were Black and African American compared to the overall percentage of the U.S. population? So if the U.S. population for Black African American was 12%, Pfizer had 9.8% of the patients were Black and African American, Moderna 9.7%, and J&J 17.2%. So that gives you a sense of, yes, they did involve a diverse group. Was it exactly 12% of the population? No, but did we have representation in these studies? Yes. Asian populations is right around 6%, and how were they represented in the studies are shown across the board, 4.4, 4.7, 3.5. If you look at Hispanic, Latinx, 17.6% of the U.S. population, and the representation across the studies were very good, as you can see here. So in these early trials, they included many individuals of all background, racial, ethnic backgrounds. The Pfizer and the Moderna are the mRNA vaccines, and the J&J is a viral vector vaccine. Again, now, all of these vaccines are either approved or authorized for use in the United States, and they can help prevent COVID-19 as well as prevent patients from getting extremely sick or severely ill and death from COVID-19. So whatever vaccine is available, we recommend you go out and get it. And now at this point, the booster is recommended across the board of all adults, and you don't have to meet certain criteria. What we put in this slide deck is what we call the Mistbusting Slides. And we have 3 in this slide deck, and I'll just let you take a look at some of them This one is around the COVID-19 vaccine. Some of these myths have been out since, early 2020, or early mid-2020. So in this false category, a COVID-19 vaccine will alter my DNA. That is absolutely false. That is a false statement, and it's been out there for a while. Vaccines are likely to affect fertility. Again, another false statement. That is not true. Vaccines contain microchips. False. So a lot of these myths and internet or social media sayings and falsehoods have been circulating throughout the community for almost 2 years now, and these things are absolutely false. One important true thing about these vaccines is certainly vaccines will help keep you from getting severely ill even if you get COVID-19. And that's what they are designed to do, either prevent it or prevent you from going to the hospital and getting seriously ill and dying from COVID-19. So you should certainly get vaccinated. Pregnant women was a controversy throughout, but it is recommended that if you are pregnant or planning to become pregnant, that you should get the COVID-19 vaccine. So that's a few I want to hit on the vaccines, but I'll move forward just for the sake of time. Testing guidelines, I won't say much here. The bottom line is CDC recommends anyone with signs and symptoms of COVID-19, regardless of vaccination status or prior infection, you should get a COVID-19 test. There are rapid tests, and then there are PCR tests which come back within, 24 hours. But if you have symptoms, you should get tested. The reason why that is so important, because the majority of your options for treatment happen sooner versus later. So when in those first 7 days, you have a whole lot of options available to you. If you wait 10 days, 14 days out before you seek medical attention, then some of those options are no longer on the table for you, and you also may be in a worse clinical state at that point. Another true false, and I'll just take a look at just two of these here. A negative test results means you are immune to COVID-19. If you have a negative test result, that means you are not COVID positive on that very day, like today. Tomorrow you could run into someone and you can be infected the very next day, and it does not mean you are immune. And also on the true side, the vaccine will not give you COVID-19. That has been a consistent rumor, but we heard that from the flu vaccine. The flu vaccine is going to give me the flu. No, they won't give you the actual disease itself. One word about these antibodies. I know we hear a lot about it in the media, on social media. So what are antibodies? So let's clear this up. Antibodies are basically proteins, and they can be made synthetically. They can be made by your own body. And these proteins are made by the immune system to fight infections, mostly viral infections. So antibodies are extremely important for preventing infections from viruses. They can take days to weeks to develop, especially after you're exposed to SARS-CoV-2, which is the virus that causes COVID-19. And if you have survived an infection of SARS-CoV-2 or COVID-19, you will have antibodies. What we don't know is how long those antibodies last and how long they are protected. How long will they protect you against another COVID-19 infection? So the protection is debatable because we have these mutations that may get around certain antibodies. Also important, antibiotics are not antibodies. Those are totally different things. Antibiotics will treat what we call bacterial infections, and antibodies are used to help fight off viral infections. So how can you obtain these important antibodies? Vaccines. So vaccines, the mechanism is to induce antibody production. So when they give you your shot, it stimulates your body to produce antibodies against SARS-CoV-2, the virus that causes COVID-19.
Dr. Taylor, I'd like to interject for just a second because I know Director Figueroa is going to have to break from us shortly, and I think we can cover a good bit of this in our Q&A. But Director Figueroa, I wanted to pivot to you for just a moment. First of all, good to see you again, friend. But want to hear HHS's take on things. If you can give us just a quick update on your end.
And I'll be quick. Want to start off by thanking you, Brandon, and also Brandon. You guys have been some good brothers for a long time. I remember when we met in the Hill a long time ago, and how we clicked because we were just so interested in serving. So it's always good to see you. And I also want to thank the National Quality Forum on behalf of the Biden-Harris administration. The office I lead, as you mentioned, Brandon, in the introduction, is responsible for making sure that stakeholders are at the center of everything we do. There are a few relationships more important to us than the one that we have with NMQF. So thank you. I'll keep my remarks brief to allow for questions. Dr. Taylor's presentation did a good job outlining the course of the disease, providing some background on treatments currently online or in the pipeline, and also the FDA approval process and some of the misinformation that we're seeing out there. So I'll focus on two things. One is beating COVID-19, and two is advancing health equity and all the policies, procedures, and regulations here at HHS. This was mentioned before, but COVID-19 has claimed more than 790,000 lives. And I have to tell you all, and Dr. Taylor again did a good job mentioning this, is that how this pandemic has taken advantage of what are pre-existing and long-standing structural and cross-generational systemic injustices across essentially all sectors, resulting in African Americans seeing a disproportionate impact in several areas, including infections, hospitalization, and death rates. So since being sworn into office, the Biden-Harris administration has prioritized an all of government effort to allocate, distribute, and administer the COVID-19 vaccine in ways that factor into realities that we live in an often separate and unequal America. So what does that look like? We've done a number of different partnerships across communities to provide vaccine supply directly to centers and providers serving high-risk individuals, people of color, people living in rural areas, and people struggling with poverty. This has been an unprecedented vaccination effort. We still are seeing, and the data still shows that Black people are less likely than their white counterparts to have received the vaccine. But we're also seeing some progress because there is a narrowing of that gap. And that's in large part because we've done a lot of good work to try to make sure that people have the information they need to be able to make the decision is good for them. There's naturally a renewed concern about the pandemic in light of the Omicron variant. We are learning more about it, as Dr. Taylor mentioned, but we are also more prepared for Omicron than previous variants. So 60% of Americans are fully vaccinated. Booster shots are authorized for adults, and vaccines are also authorized for kids 5 to 11. And then the FDA is reviewing additional antiviral treatments for when people get sick. We also know the path to controlling the virus and limiting variants. So get vaccinated, get boosted, and also take your children to get vaccinated. But there's also more work ahead. And we at HHS know that we must engage those who remain unvaccinated. A population that, despite conventional thinking, is not homogeneous. So their unique circumstances and their experiences must be centered if we want to increase the percentage of folks who are vaccinated. So this administration doesn't pretend as if it knows everything. And so we're looking to the folks that you have on this call, Brandon, to help us out, to be innovative, to think about ways that we can get more people to trust the vaccine, to get vaccinated, and also encourage their community members to do the same. So I also want to take the opportunity to mention health equity because the pandemic has brought into focus social and racial injustice and inequality to the forefront of public health. And it'll be irresponsible for us not to talk about it, right? So we talk about the disproportionate impact that COVID-19 has had in communities, but it comes as no surprise that all these structures have been longstanding, and we need to figure out now that we're here, not only how to fight the pandemic, but also make sure that we are doing a better job so that when we get out the pandemic, we are in a more just America. So that's in the way that we do our vaccine policies, right? Which is to bring vaccines to people along with focused messaging. But it's also in our drug overdose prevention strategy that we released a couple of months ago that acknowledges that the injustice and how this country treated people who were drug seeking when the faces of those who were struggling were Black and were brown. Earlier this week, the Vice President hosted the White House Maternal Health Day of Action. And this event marked a national call to action to protect and strengthen maternal health because unacceptable that Black women are 3 times more likely to die from pregnancy-related causes than white women. and there's more to come, right? Within the Build Back Better framework, we are on a precipice of transformative investment to improve health equity through universal and free preschool for 3 and 4-year-olds. We also have an initiative in there that creates the biggest opportunity to expand affordable healthcare in over a decade. One of them is to cover the Medicaid coverage gap, which is an opportunity for us to cover individuals that live in states that have not expanded Medicaid, right? So you think about how important it is for folks to have access to healthcare to improve their overall health. This is going to be transformative. Think about the states that haven't expanded Medicaid. It's Georgia, it's Alabama, it's Mississippi, it's Texas. Think about what that means for racial justice and the history that these states have had in the past as it relates to African Americans, and how if we were to pass this, and when we do pass it, it'll be able to kind of correct some of these injustices from the past. I want to end because I do want to allow for time for questions, but I want to reflect that when I first started working on this issue on COVID-19, I was the Deputy Secretary of Health in Virginia. And I remember being Deputy Secretary of Health and being in Richmond when we had our first confirmed case. And I remember the confusion. We didn't know how it spread. We didn't know where we were going to get testing. What is testing? Then came the misinformation. Then vaccine distribution was a challenge. Who was getting the vaccine? How were they getting it? Where were they going to get it? What does distribution look like? And I want to say that we have made tremendous amount of progress. There is still a lot of work to do, but I do want to emphasize that the only way we're going to get to better is if we work together. And I'm really appreciative of this forum and all the work that you do, Brandon, and all the work at NMQF to make sure that the voices from the community are being heard and are being lifted, because that's the only way we're going to get out of this.
Well, thank you, Director Figueroa. I know you have a hard stop in 8 minutes, but I do want to take a deep dive into some substantive policy questions. And I'm going to start with you, Director Figueroa. At Amazon, we have a personalized, hands-on approach to educate our employees about, the virus and to fight vaccine hesitancy. In fact, Dr. Vin Gupta, who is he's Amazon's Chief Medical Officer, also a NMQF 40 under 40 awardee a few years ago. He's conducted dozens of in-depth discussions and sessions for our employees, and an estimated 200,000 employees from across Amazon have been able to catch up with his briefings. My question for you, Director Figueroa, is you're doing a lot in this space as well when it comes to educating the masses. Since President Biden took office, we've seen ramped up efforts to share factual information and COVID updates with the public, such as televised briefings from the COVID task force. Can you share how HHS engages with the public in general and concerning equity issues?
So it's first is getting the advice of folks who are doing the work, right? So we made historic investments in community members who are trusted messengers to make sure that we know what are the concerns of the folks that they serve. But it's also customized in the way that you mentioned, Brandon. And not everyone receives information the same way. Sometimes putting a physician on TV is not the best way, right? Although it's a good way to reach the masses. And so being able to work with community members and community centers to identify who are those individuals, being able to give those individuals the training they need to be able to speak to folks, is being able to do it in language, right? So, my mom in the Bronx may not go to her physician, but she does trust a neighbor, right? So making sure that the neighbor has that information. It's putting vaccine not only in clinics, but also, supermarkets, right? Everyone needs to go to the supermarket, right? And so it is that. It's. I want to give you like one straightforward response, but the reality is that it looks different depending on the state, the locality, and the community. And so we are relying on our trusted messengers and our community core to be able to help us understand what people need and how to meet them where they are.
Well, cultural competence is key there. So I appreciate your efforts, again, to educate our communities. And Director Figueroa, I want to give you the opportunity just to offer last remarks before you close out.
Yeah, look, I think we're in a different phase of this emergency. We're 22 months into it. I think Dr. Taylor did a good job in talking to us about where we started and where we are, and even some of the things that we still don't understand. I want people to take away from this conversation that we don't also pretend to know what all the solutions are, and that we are relying on partners like you all to kind of tell us how we do a better job at the job that we're doing. So that's everything from messaging, right? Are we using the right kind of messaging? Do you have the tools you need to be able to speak to the folks that look to you for information? Is distribution where it's supposed to be, right? How do we ensure that it is in places where people go? How are we ensuring that the services we provide are being accessed, right? So it's one thing to have a service, it's another thing for people to use it to improve their lives and livelihoods. So what does that look like for folks to know how to apply for the child tax credit, right? Or what does it look like for people to convince their legislators to work with us on childcare? So we are looking for more help. And I know that you don't hear that from government often, but it is an understanding that the only way that we get through this and we come out on the other side is if it's a collaborative effort. And so, you have my information. I'm hoping that folks will take me up on the offer. We have 10 regional offices across the country. They're also available. They work with all the different HHS divisions. So please reach out and let's figure out how do we work on this.
Brother, thank you for your time. It's always a pleasure to see you.
Pleasure's all mine. Talk to you soon.
All right, take care. Dr. Taylor, I'm gonna spin things over to you now.
All right.
So this is my question. What is known about the COVID-19 Omicron variant? How is it different from the Delta variant? If you're breaking that down, making it plain for folks back home, what's that difference?
Yeah, so what I would start off with, all of these variants to date, roughly 99% of them occur in a particular place, and it's what they call on a spike protein. If you look at these pictures circulating on the internet, there are some little spikes coming off of a circle in these COVID-19 viruses. And those spike proteins are the proteins that are used to attach to your cells in your body and fuse into your own cells. And these mutations or variants are changes in that spike protein. And what that means is all medicines or vaccines that are designed to block that spike protein, like vaccines, monoclonal antibodies, they may become less effective if that change in that spike protein is so vastly different from before. It may make that vaccine or monoclonal antibody ineffective. So it's changing the spike protein. So Omicron, difference from Delta, it made additional changes to that spike protein that is assumed to make it more what they call transmissible. So it can, move to the next patient from patient to patient easier, and then it can attach to those cells and get fused into your own cells easier than the Delta variant. Now, the data is yet to be fully recognized because the cases still are relatively low for the Omicron. Delta is still the predominant variant in the United States. So we are expecting that to change. How soon, we don't know. But the differences in the spike protein that may make Omicron more transmissible as far as going from person to person, and it may make it more infectious, so it may provide or may offer more severe cases of the disease. But that yet to be seen, and I don't know if it's going to be seen here in the United States because we do have vaccines on our side. Over 200 million folks have been fully vaccinated. So although in certain countries where we've seen this spike and it looks fairly dangerous from the outside looking in, we may offer protection more than others, and we've also done a great job with the boosters. And we also have done a good job with other things.
Well, that gets me to another question then. We're seeing these variants. We're almost 2 years into this pandemic. Are we still seeing the level of disparities regarding infections in Black Americans and Latinos that we saw in early 2020?
Well, what is consistent is the level of hospitalization and death in Hispanic and Blacks. So when we put this deck together, that data hasn't changed since early 2020. I think first and foremost, there's a lag in the data, right? As more and more, let's say, African Americans got on board with the vaccinations, then it will take some lag time before we know if deaths decrease or hospitalizations decrease. So there's some lag time. So if those populations got on board with vaccinations 6 months later, you'll see at least 6 months or more of lag in the data. I think we probably made progress on both ends. I think the vaccines are going to start to show their benefits in these populations when it comes to hospitalizations and deaths as we continue to look at cases from now through however, if this ever ends. So I expect to see an impact.
Well, I want to piggyback on that then. What kind of data, this is an audience question. What kind of data do we have on the effectiveness of vaccines on the variants, Delta and Omicron?
So the Delta data was out there. It was presented, and it showed that the mRNA vaccines, both Moderna and Pfizer vaccine, showed consistency as far as preventing hospitalizations and death. So they were fairly consistent from the Alpha variant to the Delta variant. So consistent on the severity of cases. What the change was is that they didn't show the same consistency as far as preventing COVID-19. So more people could get COVID-19 from the Delta variant than they were from the Alpha variant. But the most important piece of the vaccines and the way it works in preventing severe cases, that stayed consistent between Alpha and Delta. Omicron, we don't know yet. They're still looking at the data. A, will it stay consistent as far as preventing COVID-19 itself? And B, will it stay consistent as far as preventing severe disease or death is what we're looking at. Now, this severe disease and death, that's a lag type of data set. You only know after the fact, right?
Yeah.
You get a sense of it earlier on as far as the number of cases that you can see. That's the early data. You can get a sneak peek of that. But the mRNA vaccines seem to be consistent for Delta, and we hope it will be consistent for Omicron, especially when you put boosters on top of it.
Okay. I want to swing to another audience question. This is from Adamula. And he's asking in the chat, as the country tries to increase vaccination rates in parallel with variant changes, how effective can getting more vaccines in arms help counteract, challenge, or slow down variant shifts? And
so
thank you.
I think the boosters can be very effective. Baseline vaccinations, I think we're at a solid baseline vaccination rate. I know more people are coming on board slowly with the way it's implemented now, because now you can go to your local pharmacy. So if you see people in your community actually sitting in the store getting a vaccine in the supermarket or the Walgreens, CVS, more people in the community may be, more inclined to go. So, but that's a slower process. So we had a strong baseline of fully vaccinated individuals. I think the boosters will help because that decreases the virus's ability to transmit to other individuals. So I think we have a positive step there by giving the boosters. I think that's why the FDA recommended the 15 to 16 and 17-year-olds get the booster right now. And I think that's why they expanded the boosters to anybody. You didn't have to have a certain condition to get the booster. So all of those will help fight off variants as they come along. And I think those are good ways to do it and appropriate ways to do it by expanding the booster and bringing everybody else along slowly who haven't been fully vaccinated.
Okay. Well, this is something that I'm sure is on a lot of folks' minds right now, just being the time of year that it is. We're in the holiday season, and travel during Thanksgiving was the highest it's been since the pandemic began. Does the data reflect higher rates of COVID infections, and should we be concerned about the upcoming holiday travel given this new variant?
So this is what I would say concerning, Thanksgiving was on November the 26th, and that is exactly, 2 weeks from today, right? So we know what we know about the virus. It has a certain incubation period. So in those first few days, you may not have symptoms, but up to 10 days, we should see now the impact of families getting together for Thanksgiving. Today, it's been 2 weeks. So if there is going to be a large impact from that, we should be seeing it now or seeing it over the next week or so. From what I can tell from the data, yes, the cases have gone up, right? If you look out there, you look on the website, cases have gone up, but hospitalizations have creeped up slowly in most areas. So the impact, I think, of vaccines have probably what they call flatten the curve to the extent where, although there's more cases, the severity of cases seem to be holding, and hopefully we won't get this big spike in cases, hospitalizations, and death. And I think that'll be mostly because people were vaccinated and or got the booster on top of being vaccinated. So as far as for Christmas, I know we all want to be there. I think we have time for people who either got sick to be well, quarantine, clear the virus, get vaccinated, and then the next holiday, I just will ask that people continue to use the precautions that we know work. Vaccinations, boosters, masks, hand washing. I think you can still get together, use those precautions, and if this post-Thanksgiving peak stays as flat as it is, I think we'll be okay.
Thank you very much. I want to move real quick just to a poll question for our audience in light of what we're saying with holiday travel and other things. So the question is this: have you already or do you plan to get a COVID-19 booster vaccine? Please, if you'd like to participate, add your comment to that poll question. Want to see how folks are doing and where people are right now with respect to that booster.
And Brandon, before we go, I will put up the post-survey link before we jump off the call. So make sure we leave a little time so people can scan the post-survey link before we jump off here in the system.
Absolutely, and we're gonna wrap this up in just a moment. Anyway, I don't know if you want to drop that link, post-survey link right now, Dr. Taylor, and then when you have a moment as well, what we'll do is give you an opportunity to just say some final remarks that you may have. I think it's most important for me right now just to thank everybody for participating in this call. Dr. Taylor, as always, it is great to witness your genius and hear from you, to the NMQF and the NMQF community and our supporters with Amazon. We really appreciate the opportunity to have this very important, very impactful, purposeful discussion on COVID and how to help reduce disparities in communities of color. So, Dr. Taylor, I will turn to you for final remarks, and thank you again.
Yeah, thanks, Brandon. What I will say, I did just put the post survey up, so take a look at that. I think it's important for us to consider a few things, and I think Marvin said it. We've learned a lot in the last 18 months. We've probably done more in the last 18 months for a specific disease than I've ever seen in my whole lifetime in healthcare, on how swiftly we got vaccines up and therapeutics up, and educational efforts that continue to go on. I know it looks kind of slow, and the virus seems to keep changing on us and making us change, but we have to respond to the virus as it comes and do your part as far as being vaccinated, getting the boosters, wearing your mask when appropriate. And I think we can get over this, but it's still time to be diligent. We are in the winter months, so we can't just hang outside. We'll be doing a lot of stuff on the inside. But I would like to thank NMQF certainly for putting these type of programs together so we can learn from each other. If you need this slide deck and this type of information to share with your community, then I think it's important for you to go out and do that, because community members seem to follow people that they trust. I think that was an important step when we got vaccines out into pharmacies. Then people could see it being given right in their neighborhood. You didn't have to drive off to any other place. It's right there in your neighborhood. So all of these steps continue to be important. Thank you guys for the opportunity to speak on COVID-19. If you, by chance, or you know anyone who has COVID-19, timing is very important. So make sure people take it seriously, act fast, where you have all of the potential therapeutic options available to you. So recognize it as soon as you can, get tested as soon as you can, and then you will have the full regimen available. Thanks again, everyone.
Well, thank you again, Dr. Taylor. And it looks like we have the results of our poll questions up and at them now. Thank you again, Dr. Taylor, and thank you to the NMQF team, Brandon Garrett, Keiko, Dr. Puckrin. We truly appreciate you all putting this webinar together and look forward to many more to come. Happy holidays to all, and if you haven't got your booster, get boosted. So thanks again. Have a great day, great weekend, everyone. Take care.